But in Nyeri, nurses have called off the strike, ending what has been an agonizing 9 days for patients in that county. Martin Nene is on standby. And Martin, could you give us the details that led to this calling off of the strike, and if that is possible to hold some peace for quite some time?
All right. Very good morning to you, Sam Getuko. We're coming to you live from Nyeri Referral Hospital, the largest facility in this particular county. Sam, what has happened is that in the past few days we saw developments concerning the nurses' strike. The day before yesterday, we saw Governor Mutahi Kahiga coming out and saying that he was giving the nurses an ultimatum of returning to work within the shortest time possible or face the sack. But yesterday, there was a long day meeting involving the nurses, the deputy Governor Caroline Karogo, and later the governor, and they were able to come up with a deal. The deal was that the nurses should go back to work this morning, and it also stated that the county government said they actually have the funds to pay these nurses, but they're going to be waiting for the guidelines from SRC, that is the Salaries and Remuneration Commission, and therefore they're going to act. And there was a committal on the government's part saying that they're going to be following up with the matter with SRC to ensure that they can be able to pay the dues of the nurses. And there was also that question of, is this sustainable? And Governor Kahiga was actually very, clear, saying that counties have had a challenge, of course, when it comes to, how much money they spend in paying salaries. But he said that he's committed to ensuring that this thing does not, reoccur. And the nurses say that on their part, they're committing to actually try to do more dialogue as opposed to going on the streets anytime they have issues. And so this morning, we're here to find out what the situation is like in like I said, the largest facility in this particular county. And I want to speak with the man in charge, the deputy Medsup, this morning, and he's just going to give us a picture of what it has been like, and maybe what it's like this morning and moving forward. A very good morning to you, sir. Kindly introduce yourself and tell us, very briefly, what has it been like in this facility without all the nurses present?
My name is Dr. Saidi. I was acting medical superintendent. Now, the nurses have been away for this week. It has been quite bad, very challenging for our patients. Initially, we had to evacuate our wards and send the patients to other facilities to take care of them. Now, they started trickling in a little bit. Some were volunteering to come in, so our emergency services were going on. However, most of our wards have been closed. We managed to open only half of the wards by yesterday, but today morning we've heard about their breakthrough yesterday, and now we are able to open all our wards as we speak today. Now the patients are just trickling in. Those who have been referred to the mission hospitals are being referred back to our facilities, and now I think by midday we should be back to full capacity.
All right. And maybe moving forward, this has been a thing that has been happening. What do you think needs to be done to ensure that, we don't see such breakdowns, for example, in Nyeri County?
First of all, it's very devastating to have a nurses strike, because nurses are the cog in our wheel in the management of patients. Once they go on strike, that means you have to shut down. The doctors can't do anything, the clinic officers can't do anything. We have to close down. Usually prevention is better than cure. If we can avoid that, you can nip this thing in the bud, because they had been threatening. They should have been engaged earlier to avoid the very, very big problem. As you see, we are rolling out UHC. Our admissions have gone up. Many patients are coming for our services, and when it is disrupted at any level, it's really having a big effect on the community. So the best thing would be if they can be engaged beforehand, dialogue before they go on strike. That will be better.
All right. And maybe looking back, days have been lost. Nurses have not been there. Now they're back. Do you think? How long do you think it will take for the county to be, or Nyeri this referral hospital, to be able to go back to where it should be? In terms of patients maybe who went home because there was they weren't cured or they weren't treated. How long do you think it will take for people to actually, these services not only to be restored but kind of make up for the time that has been lost?
By experience, if you lose one day on strike, we lose almost a week in the management of patients. You can imagine a patient who was supposed to go into surgery didn't go into surgery, or a patient who had gone to surgery was on post-operative management. So though we are going to get back into normal, I think we'll get more than 7 to 14 days before now we come back to where we were just before the strike. Yeah.
Okay, thank you very much. And maybe before I let you go, do you think what has happened, the negotiations, nurses coming back, do you think that can be replicated across the country, to see nurses across the country maybe back, at work?
That should be the way forward. We must remember the nurses are our sisters, they are our mothers, they are their daughters, or we must engage them. We must not always victimize them. What I've seen is anytime they are given threats, they become more strengthened in their strike. The best thing will always be to negotiate, whether it's a politician, whether it's the people accountable. Always negotiate with them. They will always listen because these are their community, these are their people. The best thing will always be to dialogue with them.
All right.
Okay.
Thank you very much, Dr.
Thank you very much.
All right, I'll let him go because he says actually we dragged him from a meeting. But Sam, like you've heard, he insists that for every single day that operations have not been taking, it takes about a week for them to be able to go back to where or how things were in the management of patients. Sam, I can say that nurses are back to work this morning. But a very important observation is that probably if engagements are done earlier, maybe such strikes could be averted. So Nyeri County is back to normal, and of course we hope that this will be replicated across the country to ease the patients' pain. We're also going to be following up to see if some of these patients who are actually transferred from this facility and other facilities such as Othai and Mukurweini, whether they'll go back to those facilities or how the situation will be like. Back to you in studio, Sam from Nyeri County. I'm Martin Monene.